All right, it seems like almost every day, doctors and scientists are making incredible breakthroughs in treatment for serious diseases, cancers, and more. A new and groundbreaking procedure for diagnosing and treating brain cancer has started here at the UNM Cancer Center. It's been used to treat a woman who had been diagnosed with lung cancer that eventually metastasized to become brain cancer. This morning, we're talking with the very first patient to undergo this new cutting-edge procedure at UNM. It's known as stereotactic radiosurgery. That is Phoebe T. Ward. Phoebe, thank you for coming in.
Thank you.
And also your doctor, Dr. Donna Shergay. Thank you for coming in, doctor. Appreciate it. I'm going to talk to you about this procedure in a minute. But Phoebe, let's talk about you. So this started out as lung cancer. How long ago did that happen, and kind of how did this progress?
I was diagnosed in September of 2013.
Okay, very recently.
Very recently. And the thing I would say, just if I may for a quick moment.
Sure.
I went to doctors and asked for a chest x-ray and nobody would do it. So if you think something's wrong, go get it checked. I went to the urgent care and that's where they found it. So listen to your body.
Okay, that's a whole other story about why you asked for a chest x-ray and didn't get one. Most people don't even go to the doctor. Okay.
I just want to encourage people to
you're without
listen
a doubt.
to their body.
I wish you could tell my parents that some days. Okay, so you found out you had lung cancer. It metastasized. The cancer spread to your brain.
Yes.
Wow. What goes through your mind when you hear something like that?
What's next? What do we do next? I've been so fortunate. I think emotionally, I'm a very grateful person, and the folks at UNM have been amazing support to me, my family, and my friends. So, although there are moments when I don't know that I've felt fearful, I've felt uncertain. So I went through the radiology and chemotherapy, and it was diagnosed. My brain situation was discovered in mid-January.
Okay.
After I'd completed the treatment for my lungs.
Okay. Did you do all that at UNM Cancer Center?
All of it.
All of it. Okay. Dr. Donna Shergay, what would normally be the process if someone has cancer in their lungs that spreads to their brain? Before you got this new technology, what would happen?
We would treat probably the whole brain.
Okay.
Or sometimes, it depends really on the patient. Sometimes we would treat a partial part of the brain, but it would be a much larger treatment area than what we did here.
And I imagine the more you treat, the more side effects you have.
Exactly.
Okay.
Yeah,
now this new, it's a stereotactic radiosurgery. Phoebe is the first person you performed it on here. What does that do for someone?
Well, stereotactic radiosurgery is not completely new. I want to make that a little clear. It's been around for many, many years, but it's new to our center. And the reason that we can do it now is we have treatment devices that are much more precise, and they can treat down to a sub-millimeter accuracy, which is, you know, probably the accuracy of a pinhead or something like that.
Oh my goodness.
Yes.
So what does that do for the patient, Phoebe in this case?
Well, then Phoebe was allowed to, during her treatment, it was a single fraction with a very high dose. Otherwise, she'd have to come back multiple days for a less of a fraction.
Okay.
So,
what we usually think of as
yes, as a normal course of radiation.
Radiation therapy. How do you feel today, Phoebe?
I feel quite well, and I'm fortunate that every treatment they've done thus far has been successful. I've responded well to everything. This particular procedure, that tumor is gone.
Cancer-free?
No.
No. Okay.
Because it showed up somewhere else in my brain.
Oh my goodness. So you're going to go back for more
tomorrow?
Than I imagine.
No,
okay.
I won't have this treatment. I'll have a different one.
Have a different treatment. Well, I got to tell you, your outlook on life, you know good things are ahead for you.
I know that. Thank you.
Yeah, your outlook is amazing. Dr. Shergay, thank you for coming in and sharing your story. Phoebe, thank you for coming in. Best of luck with everything. Let us know how it goes.
Thanks so much.